Hello friends, let us now learn some important points about viral hepatitis. Viral hepatitis, it can occur, it is actually due to virus. So hepatitis can be of five types. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. Okay, any type of hepatitis, all these types of hepatitis can result in two outcomes. Two complications actually. One, these hepatitis can cause acute hepatitis or acute hepatic necrosis can occur. Second, the patient can develop chronic hepatitis also. In both these cases, either acute hepatic necrosis or chronic hepatitis, the patient will present with number one, portal hypertension can be seen in the patient. Similarly, the patient can develop slowly cirrhosis. So these are actually the complications of either acute hepatic necrosis or chronic hepatitis. And all these patients are actually of increased risk of hepatocellular carcinoma. So let us learn each of the hepatitis in detail first, some important points, and then we will see ultrasonographic details. So first, we have hepatitis A. So hepatitis A is a disease which is seen worldwide. That is, all the countries of the world we can see cases of hepatitis A all over the world, and these are diagnosed. And for diagnosis, we will use antibody to hepatitis A virus is used for diagnosis. And the main, how does the patient get this disease? What is the route of transmission? The route of transmission of hepatitis A is fecal-oral route of transmission, and this hepatitis A is actually very common in developing countries like India. In developing countries like India, hepatitis A is most common, and this hepatitis A in India or in any developing countries, it is endemic. And here in developing countries, the infection occurs early in life. We can see the infection occurring in young individuals, and in early in life, we can see the infection to occur in developing countries. Then we have the next type of hepatitis, which is actually hepatitis B. This hepatitis B is it occurs parenterally. Here it is either parenterally, that is through blood products, and or it can be due to sexual contact, or it can be from mother to baby, that is through birth. Hepatitis B, you can see the presence of carrier state is present in hepatitis B. That is, in hepatitis B, some of the patients carry the virus, but still do not show any manifestations. So, what are the markers of hepatitis B? The markers of hepatitis B is HBsAg and also anti-HBC are the markers of hepatitis B. Then we have the next type, which is hepatitis C. Okay, this hepatitis C is a disease which is actually associated with post transfusion. That is, after transfusion, this hepatitis C is the most common type of hepatitis. So it is called as post transfusion hepatitis. And this hepatitis C is also common in those people who share needles for intravenous drug injection. They can take intravenous drug injections and they can share needles. Those who share needles or those who inject drugs, in them hepatitis C is more common. And hepatitis C is at increased risk of chronic infection also. That is, if you see, almost 85% of the patients of hepatitis C will develop chronic liver disease in time. Okay, then how are you going to diagnose this hepatitis C? The main diagnosis of hepatitis C is mainly by an antibody to hepatitis C virus, which is anti-HCV. And the treatment is, because it leads to chronic liver disease. So as a result, liver transplantation may be necessary in patients with hepatitis C infection. Or even recently we have developed, the scientists have developed some of the important antiviral drugs for hepatitis C, and these antiviral drugs are also showing good improvement of hepatitis C. And this hepatitis C also has risk of development of hepatocellular carcinoma in these patients. Then the next type of hepatitis is actually we have hepatitis D. This hepatitis D is also called as delta hepatitis. It is called as delta hepatitis. Actually, this hepatitis D cannot occur in nature alone. It depends on HPV for its infection. If it has to cause an infection, the patient needs to have a hepatitis B infection prior, or the patient should get both hepatitis B and hepatitis D infection together. Only then this hepatitis D can cause an infection. This hepatitis D also requires HBsAg. Why? For its envelope coat. So if this is hepatitis D, it requires hepatitis B around it in order for it to cause infection. So this requires hepatitis HBsAg will require hepatitis D will require HBsAg for envelope coating of hepatitis D virus. So this hepatitis D virus is most common in intravenous drug users. In intravenous drug users, this hepatitis D is most common. Then the next type of hepatitis D is the next type of hepatitis is hepatitis E. This hepatitis E is mainly caused by fecal-oral route, and it is a self-limiting disease. That is, it decreases or resolves on its own. Hepatitis C resolves on its own only in those individuals who are actually immunocompromised or who have less immunity. Only in those immunocompromised patients, the patient with hepatitis E infection can develop in chronic hepatitis, or else in most of the individuals who are immunocompetent, the hepatitis will resolve. So these are the important points about different types of hepatitis. In the next class, we will see about the clinical manifestation of different types of hepatitis. Thank you.